points to cover any bone. Okay, we need to know the site, then the type of the bone, the most important features, and how to know right from left side, and then the important muscle attachment and the related structures. Then we go for the articulations and types of the joints, and finally the clinical importance pattern. So first we start here by the hip bone. So you can see this one here, the hip bone. So the hip bone basically, we call it the pelvic bone also, and it will be forming the pelvis along with the sacrum, as you can see here. The two hip bone, they are joined anteriorly here in the pubis symphysis, which is a secondary cartilaginous joint, and backward they are joined by the sacrum. Okay, so they will be forming the pelvic cavity. You can see here there are two cavities. The one above this pelvic inlet, we call this one pelvic inlet, which is formed by the upper border of the symphysis and the iliopectineal line, and the upper border of the sacrum. This one we call pelvic inlet. So above it we have the greater pelvic cavity, or we call the false cavity, and then we have the true pelvic cavity, which is below this line. We call the pelvic inlet, or true pelvic cavity, or lesser pelvic cavity. Okay. So basically the hip bone is formed of three bones which are joined here in the acetabulum. So basically they are those three bones will be growing by three primary centers: 1, 2, 3. Each bone will be having its own primary center, and they grow and fuse here in the acetabulum. Supposed to have here a Y-shaped band, look like Mercedes sign. Okay, but it's not here in this bone. So we have the three bones named as, we have first the ilium, okay, then we have the pubis, then we have the ischium or ischium. Ischium or ischium, okay. So those three bones will be joined here in the acetabulum. So we go for the features of each bone. Before that, we need to know the type of the bone. This one is an example of irregular bone. This one is an example of irregular bone. And this bone
regular or irregular?
Irregular. So this bone will be located in the pelvis, as we mentioned before. For the important parts and features, so we go one by one. So first for the ilium. So you can see here, you have here the iliac crest. And for the iliac crest, there is an inner lip and outer lip. And they provide very important muscle attachment. And then if we look at the ilium, we can see that we have an outer surface and there is an inner surface. For the outer surface, there will be three important lines. First will be have the anterior gluteal line and posterior gluteal line, and then we have the inferior gluteal line. Okay, so we have anterior, posterior, and inferior gluteal line, and those provide attachment to the gluteal muscles. That's why we call that gluteal line, and they are located in the outer surface. Okay, then we have the inner, or we call the pelvic surface. You can see a little bit smooth, and it contains this fossa, we call the iliac fossa. And this articular surface which articulate with the sacrum. Okay, and there is an eminence here, or a line we call the iliopectineal line, or we call it the iliopectineal eminence. Iliopectineal line or iliopectineal eminence. Then in the ilium we have four spines: anterior superior iliac spine, anterior inferior iliac spine, and behind we have posterior superior iliac spine and posterior inferior iliac spine, and they provide also muscle origin for important muscles. So those are the common features here in the ilium. Okay, so we have the iliac crest, we have the gluteal lines, the anterior, posterior, and inferior, and we have the iliac fossa and articular surface, and we have the four spines. Okay, we go to the second bone, which is the pubis. The pubis will be the one located anteriorly. Okay, so you can see the pubis formed of body, and then we have the superior ramus, and we have the inferior ramus. Body, superior ramus, and inferior ramus. If you look at the body, you can see that you have a crest, we call the pubic crest, and lateral to it there will be the pubic tubercle. So we have pubic crest and we have also the pubic tubercle. Okay. If you look here, you will see that there is a big foramen here. This one we call obturator foramen. Okay, and there is a groove here we call the obturator groove. So obturator foramen and obturator groove. Basically, this foramen will be closed in our body by the obturator internus muscle from inside and obturator externus muscle from outside, and also the obturator membrane. All those will be closing the foramen, but this groove will allow passage for obturator vessels. So this one for the pubis, so we have the superior ramus and also the inferior ramus. For the ischium, you can see also it's formed of body, superior ramus and also inferior ramus. And you can see that inferior ramus of both ischium and pubis, they are joined to form the ischiopubic ramus. Ischiopubic ramus provide